This video is to provide you with the tools to make the best decisions about cataract surgery. Hi, I'm Dr. Melki. I founded Boston Vision in 2000 with the goal of putting together a practice that delivers to patients the best surgeons, the best clinical outcomes, and the best customer service. What are cataracts? Cataracts are a cloudiness in the lens of the eye. It is not a new growth. The best time to remove it is when it starts affecting your daily activities. On occasion, some patients don't seem to be complaining much about their vision, but their cataract is becoming thicker and thicker. Then we recommend removing the cataract because waiting longer can make the surgery more risky. So it is best not to wait too long to have the cataract surgery because waiting longer can increase the risk. Cataract surgery is relatively fast. Sometimes it takes less than 10 minutes, but it is surgery, meaning there is a risk: infection, inflammation, losing vision, retinal detachment. All these things can happen. They are quite rare. The rate of success is very high, more than 99%. That said, I would advise you to read the consent form and educate yourself about all the things that can happen with the surgery itself. I tell patients that when you have cataract surgery, assume you're born again. You have opportunity to pick the vision that you want, and the vision that you've had is not relevant anymore. So if you were able to read without glasses prior to surgery, you're not necessarily going to be able to do that. You have to pick what kind of vision you want, and this is the opportunity for you to do that. And when I say about what type of vision you want, this is the vision without glasses. Your vision is going to improve whether it is with or without glasses. The decisions that you have to make after watching this video are where you want to go and how to get there. What I mean by where you want to go is what is going to be your vision without glasses after surgery. This can be either good distance vision in both eyes. It can be distance in one eye and reading in one eye, that's called monovision, or reading without glasses in both eyes. Most people don't pick the option of reading without glasses. Why? Because that means still buying expensive glasses after surgery to see at distance. Some people prefer to keep it simple and look at distance in both eyes and not do one eye distance and one eye close-up, while others like the flexibility of doing monovision, where one eye is calibrated for distance and the other eye allows you to see mid-range. With monovision, you will still need glasses probably for small print, but for things such as your cell phone, computer, dashboard, this is where monovision is really helpful. Most people adapt very well to monovision, and that difference between the two eyes does not bother them. Once you decide where you want to go and what type of vision you want, then we need to decide how do we get there. And this is where the options that you're going to read about matter. With the first option, this is what's covered by insurance. It will get you there about 78% of the time. There is no additional cost other than what you pay as deductibles by your insurance. And it's a pretty good option. You're still going to be better than what you are now. So option 2 is a safer option because it replaces many of the manual steps with the laser. So there's increased safety, there's increased precision, and it allows us to use the laser during and after surgery, meaning if we need to do an adjustment, we can always do an adjustment after surgery in the office with the laser. That's included in the fee that you pay, but it is only a one-time adjustment, and it is an additional surgery. The chance of getting what we want without glasses with option 2 is about 90%, and with option 1 is about 78%. Option 3 is the option where you can do several adjustments without having to have additional surgery. And this is where the main advantage of the light adjustable lens comes into play. It allows us to do 3 adjustments, simple ones, done with the UV light in the office, and allows you to experiment with the vision that you want. So it allows you to really test drive the vision that you want. If you're not sure whether you want monovision or not, the light adjustable lens will allow you to try that. And then, very simply, with a 1-minute treatment, we can change it to distance or more close-up. I find patients who pick the light adjustable lens are extremely happy with the results. The chance of getting the vision that we want without glasses is close to 99%. Option 4 is an option where we implant multifocal lenses. The advantage of multifocal lenses is that you will see distance and close-up in both eyes, as opposed to monovision, where one eye is for distance and one eye is for close-up. So that's the advantage. The disadvantage is that many patients notice rings and halos at nights when they drive around lights. Regardless of the advantages and disadvantages, you should discuss with your surgeon which of these options are best for you. One question that I'm always asked: is it worth it to pay more than what insurance covers? And that's a very good question. I want to clarify that no matter what option you pick, you should be better than what you have now. Your vision should improve with or without glasses. So we are going to do our best to get you to where you want to be, regardless of what option you pick. And by all means, don't put yourself under financial pressure to pick option 2, option 3, or option 4, because these options are really nice to have, not necessarily have to have. But this is your opportunity to really give yourself an implant and a vision that's going to stay with you for the rest of your life. This is your only opportunity to do that. And if these options are within your budget, I would highly recommend considering that. Why should I have my cataract surgery at Boston Vision? And the answer is simple: because we give you the comfort of excellence. The comfort of knowing that anything unexpected can be handled by a very experienced surgeon. We have the best technology around, and most importantly, we are there, present for you. Our staff is present for you. All our surgeons will give you their email, their cell phone number, and we can reach us at any time for anything unexpected.